Is it ready?
I'm ready.
You are called to a home residence for a 44-year-old female who called in complaining of chest pressure, vomiting, and lightheadedness.
Alright, BSI.
Yeah, go ahead.
Alright, BSI, missing safe.
Scene is safe.
Alright, I introduce myself. Is the patient by herself or family?
The husband lets you in, and he says right before you got here, she actually passed out, and she's not really responding to you.
Alright, I have one patient. Make sure almost right now, syncope with chest pain. I guess I would consider C-spine because she passed out. She passed out on a chair, floor.
He says passed out on the sofa.
On the sofa. Okay. Okay, so the first thing I'm going to do is check for responsiveness.
Okay, how would you do that?
Trap. She awake right now, or?
So we start with painful stimuli right away?
No, you try to talk to her.
Just go ahead.
Alright.
Talk to her.
Oh, man, how's it going?
She's not talking to me.
Okay, so then I'm going to do painful stimuli.
How would you do it?
A trap.
Trapezius. Okay, she grimaces, she makes a face.
Okay. I would check, so my patient is responsive to pain. I would check if my airway is patent.
Go ahead, check.
Alright. I would do head tilt.
Yeah, if we're going to say you do not see any signs of foreign body airway obstruction, there's no secretions, and we're going to say you hear breathing, but it sounds like some snores breathing with a tongue obstructing the airway.
I'm obstructing the airway. So I would try to insert a NPA.
She gags.
On the NPA?
Oh, sorry. Nasopharyngeal airway shear times.
Alright. Accept it. First, how to do that first.
And remember,
That's
you have partners here
Yes.
who can assist you.
My airway. Where's my airway?
It's
Alright.
secure.
So she accepts the MPA, so she has snorers respirations. I'm going to have my partner start bagging.
Okay.
What's my respiratory rate before bagging?
We're going to say respiratory rate is 26, and it's shallow.
Shallow. My lung sounds.
Where's your stethoscope?
Alright. Listen to the front first.
Clear.
Alright, and the lower lobes.
Clear. Lung sounds are cleared by that.
Bilaterally all sides. What's my saturation?
With BVM ventilation is now 95%.
95%. Alright, what was it without before that?
We don't know because
I didn't do it.
we never.
Alright, so how's my patient doing with the bag? Any better mental status?
No, same mental status.
Okay. Alright. I'm gonna check my skin color.
She
Condition.
has cool extremities, and she's pale, and she's diaphoretic.
Pale diaphoretic. So I'm gonna check the voids for any bleeding.
No hemorrhage noted.
Oh, hemorrhage. Alright, I'm gonna hook my patient up to a breathing.
Alright, good.
I think this is a cardiac condition so far. What's my rate?
We're going to say 38.
38. Alright. So it looks like. I'm gonna say it's a. Yeah, it's a third degree block. How's my? Yes, IV access, please, sir. I'm going to. Yeah, Yeah, what's my BP?
80/46.
80/46, and the patient's not ventilating well, so I'll try giving atropine.
Okay, let me know when it's in.
Yeah, we'll get a 12 while we're at it.
Is it 12?
Yeah.
Okay, we're gonna say the one that's sorry.
So we got an inferior, looks like an inferior wall. Elevations 2, 3, AVF. Okay. Hold on. Okay.
What time?
10:22. Alright, does the atropine do anything?
No change in the heart rate.
I'm gonna,
Is painful still my one week transcutaneous space?
yeah, we're gonna pace.
Rhythm change.
Alright, so it's like a V-fib. Does my patient have a pulse?
Patient does not have a pulse.
Alright, so I'm gonna have my BLS, I have my pads on, I'm having start CPR. Can you put it to max joules? Take it off the casing. Charge.
I got max
Alright.
juice.
Clear.
Everybody's good?
Everyone clear. Shot. Alright.
You got the arrest. What's
Yeah.
the last time? 20?
Yep. Alright. So I'm gonna have to give 1 milligram of epi.
1021. 1 milligram there coming up.
Alright. 5 minutes on the monitor, we'll do our next pulse check. After this next cycle, get ready to
Epinephrine is in.
What time is the pulse check supposed to be?
2 weeks.
It's gonna be 5 minutes. 5 minutes. So 30 seconds and we'll charge. Pulse check. I'm gonna have you guys switch.
You want any anti-arrhythmic support? Any shots?
Let's see if there is. Alright, pulse check.
No pulse.
Pulse. We got the fib still. I'm gonna shut 300 switch. And then let me get 300 milligrams. Yeah.
say positive lung sounds.
Alright. 300 milligrams amino.
Amino, 2.8. We pull up 1 milligrams epi. Charge.
Wait, charging?
15 seconds. Well, 20 seconds until full strength. Alright, I got my tubes secured. Yeah, you want it put it in? In 30 seconds. Yeah. Alright, pulse check.
Pulse is present.
Pulse is present. Alright, I'm
Cancel
gonna
out.
up my charge. Alright, I got pulses. Can I get a BP?
72 over 40.
2 over 40. Alright, is my heart rate still?
Lower?
23.
What heart rate?
What's your heart rate?
Alright, I'm gonna check for responsiveness.
How would you do that?
Ask the patient to squeeze my fingers to people.
They do not follow. Patient does not follow from that.
Alright. And I'm gonna have my partner get a 12 lead.
12 lead is the same one,
Alright.
with SC7 and changes what you said.
Alright. So,
If you want, you can stay here and help out.
Yeah.
Otherwise, you can go to any other station.
I'm gonna contact one of partners set up fluids.
Right.
20.
On the podcast again,
You know what? Yeah, let's start with this.
Capnography reads 60.
So we got a heart rate of 38, so we can put it to 70. And then we're gonna keep going up on the milliamps until we find out.
So, one thing I can tell you, right?
Yeah.
I see you increasing your milliamps, but one thing we did not do, right? You see how it says start pacing at the bottom,
Yeah.
right? So reduce your milliamps first all the way down.
Oh.
All right. Then what you're gonna do is you're gonna say start pacing. All right. Now you see those spikes appearing, right? Now we're gonna increase milliamps until you get electrical capture. Right. So keep going up until you see a spike followed by white QRS. Keep going.
Oh, there we go. I got
Huh?
capture at 70 milliamps.
Right, and now we're going to want to decrease it by, we're going to go down 5 and see if we still maintain, right? Loss, right? Loss of capture.
Yep.
So 70 was our electrical capture. Now we got electrical capture. What we want to do next? Our patient is not responding. We're going to say, how would you check the mechanical capture for the pulse?
I would check I would see if I can feel a radial pulse.
Let's say you do not feel a radial pulse.
Check the thermal.
Let's say you're not really sure.
Check the cardiac.
You're still not sure. Is it
Auscultate.
auscultate? Where?
Apex.
Apex, right? Because sometimes the contraction of the musculature, like, may give you a false sense, right? You may not feel the pulse. So if apical sounds loved up, you definitely know blood is moving through the heart, right? You're going to say matches heart rate 70.
Alright. Again, RPP.
Blood pressure now comes back at 96 over 52.
Alright, good. 96 over 52. That's great.
Heart rate is 70, the increased. End-tidal CO2 is 45. Saturation is 96%.
Alright, great. So I'm going to contact telemetry.
All right, they approved you to the closest cath lab.
Alright.
Let me know when you're ready to give your report.
So,
I remember the template they gave you.
yeah. Alright, I have a 44-year-old female with, oh shit, I didn't get a history.
Okay, so that's fine, but what you got so far, right?
Alright, who presents with vomiting, lightheadedness, and chest pressure.
Okay.
Who was started approximately 11 minutes ago. What's that? 11 minutes ago. Who also sympathized.
Okay.
We found her. She was responsive to pain in bed with snoring respirations.
Mhm.
We began to bag her with NPA, which then we put her on the monitor. She showed a third-degree block. Gave 1 milligram of atropine with no success. And we were getting ready to pace. She went into defib, we shocked, and gave her a total of 1 milligram of epi, and we shocked the second time with 300 milligram of amio. We got the tube at 10:27, 20 at the teeth. At 10:28, we got Ross. She was presenting with an inferior MI. Elevations in the inferior leads. We ended up having to pace her at 10:30 at 70 milliamps and 70 heart rate. She was, her responsiveness did not improve at all post-cross. The husband called 911 because of the chief complaints. Since we arrived on scene, she has been getting worse. And our current vitals are 96/52, heart rate 7, leaping pace, and title 45. Heart rated, saturation is 96.
How do you guys feel that?
Ah, fuck, bro.
How?
I didn't get a history. I didn't get allergies. I didn't get my OPQRST.
Right. So I would say you start out, your assessment was pretty well, your
Yeah.
primary assessment, right? What you want to do is, here, right? If your patient is unresponsive, you want to get the history from the husband,
Yeah.
medications, all that, right? So very important to render that. Now, this patient had an inferior wall MI, right? 2-3 AVF. What do you know about inferior wall MI? What our right coronary feeds what else besides the inferior wall?
Wait, I know this.
What rhythm she present with?
Third.
Third degree, right?
Yeah.
So means that AV node was taken out, right? So there's no communication. So the right coronary artery, right, as it comes up the aorta, aortic osseous feeds the SA node, AV node, right? So if you take out the SA node or the AV node, you may be dealing with some sort of a brain dysrhythmia. Here we're dealing with a third degree heart block,
Yeah.
right? That makes sense. Third degree heart block, why? Because maybe the AV node took a hit. So we have atrial ventricular dissociation. So that's something you want to pull it, right? Especially very common with very well amounts.
Yeah.
Right. Next thing, right? Patient and syncope. Why syncope? Because what is syncope? Is a transient loss of perfusion to the right cerebral circulation. So she passes out. What you want to do in this case, right? You want to gain IV access, right? You want to also try some IV fluids, right? To see changes in the mental status. Pacing is the correct treatment, right? You can give atropine because it's in your protocol,
Yeah.
but the correct choice is pacing, right? Because heart rate is 38, right? So transcutaneous pacing. So initially, right, we do not have pacing. Now we do pacing. We have electrical capture. We confirm mechanical capture that show either pulse, you cannot feel it, either atypical sounds. Do a full set of vital signs. If that still does not get you map of 65, what we're gonna do? Pressors, right? We're going to consider pressors in the setting. Probably again, norepi would be the drug of choice, right? Definitely, as you said it, right? You want to get a history from the husband. We want to know, right, for past medical history, risk factors. We want to know what medication she's on. We definitely want to know, right? What led up to the incident, like what was actually complaints on.
Yeah, I had a condition.
And one thing that we, like you were doing, right? We don't really have to list how many shots you gave or how many epis you gave. You can just say patient went into cardiac arrest, we treated for remed protocols with HA guidelines. Or we treated the patient with current AHA guidelines. They all understand, like, you're shocked, you gave epi, right, whatever else you need.
They always ask.
Yeah.
What
They
did
will-
you give?
Yeah, they will ask you that
Yeah.
towards the end, which you gave for sure. But in the early stages, right, you want to have that one-liner, right? And with a one-liner, what's important is age, sex, right? Patient's chief complaint, her pertinent history, and the duration of the episode, right? How long the pain. Just because you were on scene for 11 minutes
Yeah.
doesn't mean the chest pain was there for 11 minutes, right? So
Yeah.
maybe ask the husband, get the medications, allergies, and any complaints that she experienced thus far. We check for responsiveness, right? She wasn't responding to you. All right, and then we're going to transfer to the cath lab. Why? Because she's having an active acute STEMI, right? So, just I would say work on your reporting, and also when you're doing your team presentation, right? Try to sum up everything that's like after 10 minutes, like, hey guys, we're on scene with 44-year-old female. She was having chest pain, right? Chest pressure, lightheadedness. We so far, right? We gave one shot or no shots. We gave so many appies. We gave so many antiarrhythmics, amiodarone, right? What else can we do to it? What are the H's and T's, right? So think about that.
Yeah, that's the other thing. Sugar.
Yeah.
Yeah.
So always sum up what you've done thus far,
Yeah.
and say, what else can we be doing so everybody else is contributing to your thing, right? Do you guys have any questions? Right. Good.